Well, although my title is Clinical System Navigator, I always tell people that I'm a registered nurse because that's my training. Although a lot of the things that I do is not necessarily nursing in terms of how people view a nurse, such as hands-on technical skills. What I do most of the time is connect people with services, and a lot of times it's regarding the social determinants of health. So I connect people with whether it be transportation, food, housing, but I help the client identify their goal in achieving overall health, and I help them connect with the service that will achieve that goal.
Well, now I feel like it means I have access to so many agencies and that I didn't know were available to people who were ill. I'll put it that way, we're ill. So that gives me a lot of comfort. Some people just want someone to listen to them. Yeah, I'll share something with someone, I think I'll think they'll never identify with this or connect with it at all, and they do.
Navigating the system is actually quite difficult for the public. There's gaps in communication often amongst the healthcare providers, service providers, and so really one thing that I've learned is really try to keep the communication going with all the service providers, be that person in the middle, really trying to emphasize that we need to communicate, we need to collaborate.
I talk sometimes, I am not worth taking care of myself, so that's not healthy. And I know a small part of it has to do with living alone and being independent.
The reality is, I think a lot of people recognize that physicians or primary healthcare providers are busy. They have a busy schedule, they have a lot of people with complex medical issues, so they see a lot of people in a day. And clients, it takes, Linda has mentioned, it takes trust. You have to build trust with clients to really get them to share a lot of information with you. And I've actually had the time to sit with my clients and build that trusting relationship where then they reveal information such as, I don't have food in the home. So some clients I've gone to Salvation Army and gotten them food. Other people will reveal family issues, that relationship issues that they're having. So then I've helped with that, communicating with family. So these are things that, physicians or primary healthcare providers can't pay attention to all the time because they're seeing such a large amount of people.
After I got to know you, like sit down and just chat, I just felt very comfortable and trusting. I do trust you totally. I trust the people in this that I've met so far, that I've met in this office. And for me, that is huge.
If you didn't join HealthLink, where would you see yourself right now?
I'd just be doing the same old, same old. If nothing changes, nothing changes.
Mm-hmm. So when I initially meet my client, I ask them to review a map with all the social determinants of health, and I work with them to develop goals that they would like to work on. So obviously physical health and mental health are included, but they also include other determinants such as the transportation, housing. And together I sit with the client. I meet usually the first week to kind of understand their position, and that intake actually takes about 2 hours where I really learn about the client. Sometimes it takes longer depending on how much the client is willing to divulge, but I will provide them the time to reveal as much information as they want. And then I meet with them a second time to really identify their goals that they want to work on in the next 6 months. And I let them know that I will do a case conference, and I bring together about, I would say it's over 10 service providers that come together to sit around for a case conference to identify the client's goals, who will assist with achieving that client goal, and then we kind of identify when we will do a follow-up with the client. So all that takes place within usually I try to get it within a couple of weeks of meeting the client so that we actually have a plan of care developed, and then we share the care plan with everybody involved in the client's care.
So it's getting my priorities right, that Tracy's helped me with that. And she's setting a wonderful example for me because she does do that. So I would like to do that in my own life. I think that's a huge accomplishment. It's some self-awareness. I give myself more pats on the back than I used to. I don't think it's something that happens overnight. I think it's a matter of time and practicing what I'm thinking. Instead of I should, I am doing. Okay, I'm eating a healthy meal. I've become more trusting and honest with not only with my doctor but with others, and that's not usually how I work.
I've had the luxury of going to appointments with my clients and really advocating for them even in appointments. Sometimes I believe clients do have a difficult time speaking up or really expressing themselves, and so having the opportunity to learn really what the client wants beforehand, I can support them when they go and see their primary care provider or a specialist and really support them in that meeting.
We do need a navigator. I need a navigator, and I need somebody to be honest and open about, well, it may take a few days or it may take a month, and this may be what happens. This is a definite necessity in the community.